Hi everyone, so today I'm going to talk about a few things I wish I'd known before embarking on my medical career. Before I begin, it would be really great if you could subscribe to the Dream Smart Tutors channel. So when I cast my mind back to all those years ago when I received my letter to study medicine at UCL, I was of course very happy. However, when I started actually studying medicine, I realised how intense the degree program was. And I think it's really important that when you are applying to medicine and you get accepted, because I'm sure you will, that you just take a minute to realise the magnitude of what you've signed up for. You will have some amazing times, but also it is really hard work, and I think it's just important to bear that in mind. So I'm not going to dwell too much on what it was like for me at medical school. I really want to spend the next few moments just talking about what I didn't really consider. So when you're studying medicine, your main goal is to become a doctor. Of course, you're sitting exams, you're preparing yourself to become a doctor. And sometimes, I know for me personally, I didn't really think or consider some of the bigger issues. Now, by that, I mean, as a doctor, you're in the public domain. You are on the GMC register. If you don't know what the GMC is or what the register is, then I suggest you research that, because that's a really important thing that you should be aware of, especially if you're applying to medical school and wanting to be a doctor. So you're in the public domain, you're on the GMC register. People can search for you with your GMC number, which is a unique number given to you. The other thing is, for instance, if you're working like I do at a GP surgery, your name will be on the practice website. People can leave reviews for the surgery. In some cases, people can review individual doctors. So when I was applying to medical school, I didn't necessarily consider this. I wasn't really aware that I would be in the public domain. So the next thing I want to talk about is the fact that medicine sometimes can be a thankless job or thankless vocation. Now for me, I've spoken many times about the fact that I wanted to help people, I want to serve others, and for me that doesn't necessarily mean getting a big pat on the back, a big thank you every time I help someone or I do something nice. It's not about that at all. I think, however, in this current current society that we live in, we often may not be appreciated to the degree that we may feel we should be. For me, of course, sometimes I felt that I'm working really hard and I'm not appreciated by the system that I'm working, so that would be the NHS. Sometimes I've been in particular hospitals or particular areas and I've not felt that I've been appreciated by my team, although I felt I've been working very hard. And sometimes from the people that I'm helping, I don't always feel that I'm being appreciated. However, it doesn't stop me from wanting to help and to keep helping others. But I think you should just be aware that not just in medicine, but sometimes in working life, you're not appreciated. And it's about recognizing that and deciding how you're going to work with it, basically. The other thing I didn't particularly pay too much attention to was the fact that as a doctor you move around a tremendous amount. So there are various training programs of different lengths, and often every year you're moving to a different hospital, a different area, having to settle in. And you've may or may not have heard me speak about my career as a GP, and one of the reasons I chose general practice. And that was because I wanted a foundation, I wanted a base. I felt I had moved around a lot throughout my training, which is good, but there became a point where I felt like I didn't want to necessarily keep doing this. You may not consider it now because obviously your goal is to become a doctor, get through all your exams, which I know you will. However, it is important to bear in mind that once you are a doctor, you will be posted to different places, sometimes far away from home, sometimes far away from your loved ones, your friends, and this can take a toll on you. It can be very stressful. Also, when I was at medical school, I was 18, I was very young. I wasn't necessarily thinking past medical school to working as a doctor. It was 6 years, and so you have to think about your immediate goals, your short-term goals. But it's important to think about long-term goals, and not just within medicine, but perhaps in your personal social life. I personally wasn't thinking about having a family of my own, but when you do get older, your priorities change and things happen around you. Life events change your perspective, so it's really important just to bear all of that in mind. So when I was applying to medical school and during medical school, I was really aware of maybe two broad pathways: become a GP, become a hospital doctor, physician, surgeon. However, there are so many different specialties, so many different careers, and there are so many different combinations. So for instance, for me, I have a portfolio career, and that encompasses working in clinical practice 2.5 days a week, writing for GP Online, running my medical careers company, and a number of other things as well. And you don't necessarily think about that and the combinations of which you could have or create a medical career. So I think it's really important to think outside the box. Don't just think, oh, okay, I have to be a GP working full time, I have to be a hospital doctor, again, working full time. I can't necessarily do anything around that or outside of that. There are so many different things that you can do outside of medicine, within medicine, and together as a combination. I definitely think things are changing, especially with the rise of technology, and it's really good to see a lot of medical students now starting companies and startups, and really getting into artificial intelligence, AI, and how we can use technology to improve how we help our patients. So a lot of people in the past have asked me if I get my stethoscope for free. I don't. I think if you're applying to medical school, please be aware of a lot of hidden costs. One is obviously your medical equipment, and as a GP I have to purchase my own equipment. Depending on where you go, as a trainee, your GP surgery can provide you with equipment, and as a parting gift they might give you the equipment. However, you have to pay for a lot of things yourself. So when I say hidden costs, I just want to make it clear it's hidden costs, so things you may not necessarily be aware of, but things that are of course there. So another example could be your indemnity, so you need cover in order for you to practice in a clinical setting. Professional fees, subscriptions. I pay to be a BMA, British Medical Association member. I pay to be a part of the Royal College of General Practitioners. You have to pay the GMC a fee every year. Then there's courses, exam fees that you have to pay yourself. As a trainee, yes, you can get some of the costs covered. However, you have to pay a lot of things for yourself. The final thing I want to say is that you will never know everything, and it is very frustrating, especially a lot of the type of personalities that go on to study medicine, apply to medical school. We like to know a lot of things, we want to know a lot of things, we know it's important to know a lot of things, and there are just too many things to know, really. What I would say is that don't get too hung up on the fact that you don't know everything. You will never know everything. That's just life. But what is important is knowing where to go to find things. So for instance, in the clinic, if I don't know something or I can't remember something, I know where I need to go to find that out. So that could be the BNF, the British National Formulary, where I go to find out about the correct dose of medications, if there's a reason why I can't give a medication to a patient because of a medical condition, for instance. If someone is breastfeeding, there is a particular site where you can go to get information on medications that are safe in breastfeeding or safe in pregnancy, not just the BNF. So it's really important to know that, okay, I don't know everything, or I can't remember something. I'm going to go and find out from this person or from this source. And I think once you operate in that way, you won't get too upset if you can't remember something. So that's everything today. I hope you've enjoyed the video. These are just a few things that I wish I had known or considered or given more thought to before I applied to medical school. Please make sure you subscribe to the channel for more useful videos. Make sure you also check out our website, dreamsmarttutors.co.uk. There is an e-booklet under the resources section which talks a little bit more about what I've been discussing today really. It gives you some tips for how you can prepare yourself for becoming a working doctor.